Welcome once again to Principles and Practice of Health Assessment. Welcome once again to Principles and Practice of Health Assessment. This is the fourth session, the second part of the fourth session, and here we'll look at assessing the neck and the regional lymphatics. We'll focus on physical assessment of the mouth and then the lymph nodes. So, examination of the mouth. We need pen light, a tongue blade. So we have our pen light, tongue blade, or if we have a spatula, the tongue blade also looks like this, but you have to fix this one to the scope in order to use it. So you can use the spatula, and wooden spatula. You can also use the tongue blade if you want to examine the mouth. Then you need gauze and you need gloves. Start the examination by inspecting the lips of your patient. You know the color, the size. Note if there are cracks and sores. Ideally, the lips should be symmetrical when it is open and closed, and the upper two should rest on the lower teeth, with the upper incisors slightly overriding the lower one. The lips should be pink, but sometimes it's bluish hue in persons who are dark skinned. The lips should also be moist and smooth without lesions. So ask your patient to open the mouth so that you inspect the mouth. If there is any dentures, ask patient to remove it and you put it in a receiver whilst you do your inspection. Wear your gloves, and as patient's mouth is open, take your spatula and press it down on the tongue to allow you, using the light, you open the light into the patient's mouth, and then you press down on with the spatula so that you would inspect the structures of the mouth, noting the teeth, the gum, the tongue, inspecting the tonsils, and then the posterior pharynx. Then, whilst donning the gloves, use your glove hands to palpate the mouth, noting tenderness, ulcers, and nodules. You also check and palpate the gums, noting the color, and you also check for palpate the tongue and note the strength of the tongue. The tongue should be pink, moist, and have papilla in the midline. And the tongue should be pink, moist. There should be papilla in the midline fissures, and it should be symmetrical. You want to test also the motor and sensory functions of the cranial nerve 9 and 10. So you do this by depressing the tongue with the spatula and ask the patient to say ah. So as the tongue depressor is pressed on the tongue, ask the patient to say ah, and as they say the ah, watch the uvula and the soft palate. It should rise and fall. While the patient is saying ah, you should see the soft palate moving up. You also check for gag reflex by touching each side of the tongue at the posterior part, the pharyngeal wall. You touch using the spatula or your finger, glove finger, you touch the posterior pharyngeal wall. And if gag reflex is present, the patient will behave as if he wants to vomit. To test the motor function of the 7th cranial nerve, you ask the patient to open the mouth, then you observe the tongue while the tongue is resting. Then you ask the patient to protrude the tongue out, and then you palpate for the strength. So while the patient is stretching the tongue towards one direction, you meet the patient with a force and test for the strength of the tongue. Common disorders that you find in the mouth: stomatitis, gingivitis, thrush, dental caries, Vincent's infection, herpes simplex, cancrum oris, and cleft palate. Please remember to watch the video on the examination of the mouth as downloaded on the site, the base video, so you follow the procedure. Our next topic is the physical examination of the neck. For this examination, our focus is on the lymph nodes. So it's important for us to know where we find the lymph nodes. We can find the lymph nodes behind, just a little behind the ear, and that side is called the occipital area. So the lymph nodes there are the occipital lymph nodes. Then in front of the ear, just a little away from the tragus, we find the pre-auricular lymph nodes. Behind the ear, we have the post-auricular. And then we also have the the muscles of the neck, as you can see in your diagram. Then we have the subclavicular lymph nodes, submental lymph nodes. Submental, they are behind, just beneath the jaw. The submandibular, just around the chin. Then we also have the superficial, and then the superficial anterior cervical lymph nodes, and then the posterior cervical lymph nodes. To examine the lymph nodes on the neck, you need pen light and glove if necessary, a cup of water if you want the patient to swallow, and you see. So you start your examination by inspecting the neck, as usual, the color, and noting presence of lesions and any abnormalities. Then use part of your fingers to examine the lymph nodes. So if this is our patient, with the part of the fingers, we examine the lymph nodes, starting with the pre-auricular, post-auricular, the occipital. Then our patient's neck is so short, so we will not be able to see the other ones. But you palpate for the pre-auricular, which is in front of the ear, behind. The post-auricular lymph nodes are just behind the ear. Then the occipital lymph nodes, which are at the occipital area, as we saw in our diagram. Then the submandibular, which is just under the jaw. Then the submental, which is under the chin. Then you have the superficial cervical, the deep cervical lymph nodes, the posterior cervical, supraclavicular lymph nodes. And as you palpate, note if they are palpable. If they are palpable, then it means that they are inflamed. And you check this on both sides of the neck, the left and the right side of the neck. You document your findings. So for your assignment, perform an assessment of the mouth of the client whom you will identify during your clinical placement in your community. See if there are any abnormal structures. Then examine the neck for the lymph nodes and see if they are palpable or not. If the lymph nodes are inflamed, remember, if they are inflamed, when you palpate, you will feel a little lump at the area of the lymph node. Normally, the lymph node should not be palpable. For your references, check as shown. Thank you for your attention.